My name is Adam Bender, and I'm going to give you a very brief description of EMDR. EMDR is known as eye movement desensitization and reprocessing. This is used to treat a variety of mental health problems, from anxiety, depression, addictions, PTSD, and many, many more. The model of EMDR looks at the brain's ability to process information. Right? We have thousands and thousands of thoughts a day. And the brains, we're constantly reprocessing those and processing. The best way to describe this is, let's say trauma is an apple, right? We take a bite of that apple. We have natural coping mechanisms, which in this case are our teeth. We chew it up, we swallow it, our body keeps what it needs, it gets rid of what it doesn't. When it becomes problematic, and this is where EMDR will come into place. We take a bite of that apple, and without chewing, you swallow. And what happens? Panic. Boom, here comes the interference in our daily functioning. In EMDR, we explore a lot and talk a lot about traumas. Well, we know there can be big T's and little t's, big traumas and little traumas. EMDR utilizes rapid eye movements to access these memories. We look at what we call a window of tolerance within EMDR, right? So it's just like any window, open and close. There's some days where I'm feeling great and I can tolerate a lot of distress. I can tolerate a lot. Others days that window is pretty low and I can't tolerate much. Throughout the process and intervention of EMDR, we will constantly check with you and see where you are within this window of tolerance. What I always tell everybody is we're going to have a foot in the here and the now, where you're feeling safe and secure within this environment and within this therapeutic relationship. And then we're going to put a foot in the past and some of those problematic, scary situations, memories, and experiences. What to expect when coming in for a session for EMDR. Like many other therapies, the first thing we'll be doing is establishing our therapeutic relationship. We will explore treatment plans and what are some of those memories and experiences that are bringing you in. Okay? There's a variety of phases to EMDR. One of the most important phase is what they call the front-loading and a resource phase. This is where we will be actively practicing in our sessions mindfulness and calming skills. Because again, within that window of tolerance, there's going to be periods of time, right, where you're going to be focusing somewhat intently on some of these memories and experiences, and it will create a level of distress. But that is where those skills and coping mechanisms of mindfulness and other calming mechanisms come into play to where you'd be able to utilize them and return back down to a baseline. Generally, what I tell a lot of clients is imagine that you're sitting on a train, okay? We're taking a train from Richmond to DC. This train is going to be stopping at many different areas, right? As you're sitting on that train, you have windows on both sides of you. When the reprocessing can begin, there can be a variety of images, memories, body sensations, emotions that come up, okay? We'll go into it for a few seconds, pause. Just like that train. Once that train gets going, there can be a variety of stuff flying by. And once we stop that train, there's going to be people going off the train and onto the train. The same thing with our brain. Our brain, again, keeps what it needs and gets rid of what it doesn't. One of the goals to EMDR is to desensitize the client to certain negative thoughts or beliefs that they have about themselves in regards to the traumatic events. What we also want to do is then replace a positive thought or belief that you have about yourself in regards to that event. To whereas you think of that event, and rather than think of this horrific thing about yourself, it's a much more positive thought or belief, thus resulting in you being able to have a healthier function in your daily life.